Good morning. This is a committee on people with disabilities and special needs. I'd like to begin this meeting by letting people know that we all understand that state law currently requires that the following announcement be made at the beginning of every remote public hearing as follows. Due to the current public health emergency, City Council committees are currently meeting remotely. We are using Microsoft Teams to make these remote hearings possible. Instructions for how the public may view and offer public testimony at public hearings of council committees are included in the public hearing notices that are published in Daily News, Inquirer, and Legal Intelligentsia prior to the hearings. It can also be found on phlcouncil.com. I will now know that the hour has come. Mr. Iannuzzi, will you please call the roll to take attendance? Members that are here, will you please indicate that you are present when your name is called? And also, please say a few brief words when responding so that we can see your image and it will be displayed on screen when you speak.
Councilmember Cindy Bass.
Good morning. Good morning, Mr. Chairman and colleagues. I am present.
Good morning.
Councilmember Kendra Brooks.
Good morning, colleagues. Good morning, Mr. Chair. I'm present.
Good morning.
Councilmember Jamie Gauthier.
Good morning, Mr. Chair. Good morning, colleagues. Good morning, everyone. Happy to be here today.
Good morning.
Councilmember Derek S. Green, Chair.
Present. Thank you. Quorum of the committee is present and the hearing is now called to order. This is the public hearing of the Committee on People with Disabilities and Special Needs regarding resolution number 200269. Mr. Iannuzzi, will you please read the title of the resolution?
Resolution number 200269, resolution authorizing the Committee on People with Disabilities and Special Needs to hold public hearing regarding the parental rights of parents with disabilities.
Thank you, Mr. Iannuzzi. Before we begin to hear testimony from the witnesses we have here for today, everyone who has been invited to the meeting to testify should be aware that this public hearing is being recorded. Because the hearing is public, participants and viewers have no reasonable expectation of privacy, and by continuing to be in the meeting, you are consenting to being recorded. Additionally, prior to recognizing members for questions or comments that they have for witnesses, I will note for the record at this time that we will use the chat feature available in Microsoft Teams to allow members to signify that they wish to be recognized in order to comply with the Sunshine Act. And the chat feature must only be used for this purpose. I want to thank the sponsor of this resolution, Councilmember Brooks, for this important conversation. This is especially important because we as a city are getting much more diverse. And when I think about the language of this resolution and think about my own personal background and joy and journey with a son who many people know is on the autism spectrum, and the fact that when he was diagnosed in 2003, we're looking at 1 out of every maybe 200 children were on the autism spectrum. Now that number is much larger, 1 out of every 54, and for boys, 1 out of every 48. And as these young people, both boys and girls, become older, they are also going to have relationships, have employment, have housing, and do all the things that many adults traditionally have done, including having children and need to have all of their parental rights respected and upheld. And so having this conversation is very important to broaden this conversation and this discussion, not only to parents and families that have children with some type of physical learning difference, but for the general public, so they have an understanding that we need to ensure that everyone has the right to be able to raise their children in the way that they see fit to the benefit of their family members and for the benefit of all of us. With that, I'd like to recognize Councilmember Brooks, the sponsor of this resolution, for some opening remarks.
Thank you so much, Chairperson Green. Good morning, and thank you to everyone who has joined us today for this important hearing. We're here today to talk about the rights of parents with disabilities. This topic is close to my heart as a mother of 4 children and as someone who worked for many years with families whose children have had disabilities, and then with those children with disabilities into adulthood and even through parenthood, navigate complex bureaucratic systems that we see. My office has been planning this hearing in collaboration with activists and community members for months, and some of those who will be speaking today. And I'm glad to see it all coming together finally. I want to thank everyone who is here to testify today. Additionally, I want to thank all of the elected officials who are represented here today, either in person or through a staff member, to learn more about this pressing issue. I want to thank Representative State Rep Elizabeth Fiedler, State Senator Art Haywood, State Representative Morgan Cephas, State Senator Christine Tartaglione, State Senator Cherie Street, Councilmember Cindy Bass, and Councilmembers Gautier, and any others that I may have missed. Lastly, but certainly not least, I want to thank the chair of this committee for people with disabilities and special needs, Councilmember Derek Green, for his tireless advocacy for individuals with disability. Most of us here today know too often people with disabilities are overlooked in the decisions that directly impact their lives, or outright discriminated against within systems that were not designed for their needs in mind. Your attendance at this hearing demonstrates your commitment to ensuring that these systems are made to work for all Philadelphians, especially those with marginalized identities. And I want to recognize and appreciate that. There are approximately 4.1 million parents with disabilities in the United States, and 1 in 10 children have a parent with a disability. Yet the unique capabilities and the needs of this population are rarely spoken about. As you will hear today, having a disability in no way hinders a parent's ability to provide a loving, nurturing environment for their child. And yet, it is not uncommon for parents with disabilities to experience discrimination when navigating adoption, custody, visitation, family law, and the child welfare system. We want to bring light to the way parents with disabilities are treated differently and unfairly, because too often the judgment that determine whether they are fit to be parents are based on assumptions and biases, not facts. We know, for example, that in Pennsylvania, the disability of a parent can be included and legally determine the best interest of the child. And we know there's often a lack of consistency and uniformity that makes it difficult for parents with disabilities and their advocates to navigate these legal barriers. The fate of these families are regularly left up to individuals' judgment of government officials, such as support providers, social workers, court-appointed advocates, and judges who may not be familiar with the unique parenting styles and capabilities of parents with disabilities. These parents live in fear of discrimination and the heightened threat of having their children taken away from their home. As a result of this discrimination, they are extremely careful about which service they reach out to, because reaching out can mean losing a child or the parent altogether, as in the case of Walter Wallace Jr. Given the degree of distrust in these systems and the fear of mistreatment amongst parents with disability, we want to highlight the bravery of the community members who are speaking today about their experiences as parents with disabilities. And I know that there are many other families who may be fearful of speaking out, who are grateful for the courage that they're having in elevating this issue. And once again, thank you so much, Councilmember Green, and thank you to everyone being here today.
Thank you, Councilmember Brooks, for your opening remarks and also for bringing forth this important conversation. I'd like to also note for the record that Councilmember Isaiah Thomas is here. I want to thank all of our elected officials in Harrisburg and their representatives for being here this morning. I also would like to recognize Councilmember Cindy Bass for an opening statement as well.
Well, good morning, everyone. I just really...
Okay. Hopefully Councilmember Bass can reconnect with us. All right, Councilmember Bass.
I apologize. Connectivity issues. But I'll be brief. I just really wanted to thank Councilwoman Brooks for bringing this conversation to light. I come from a long line of family members who work with people who have different abilities, including my sister who used to work with SPIN, Special People in the Northeast, and also the Benjamin Rush Center, and as well as my very close cousin who works for Liberty Resources. And all through all of these connections, I have been made aware for many, many years of the disparity in treatment in terms of parents reaching out for assistance and the concerns, the issues, the discrimination that exists. So I just really wanted to thank the sponsor for bringing this conversation to light, because I think it's long overdue. And this is something that I'm hopeful that we'll be able to get some legislation out of locally and on the state level that we can adjust and address some of these issues. So thank you very much, Mr. Chairman.
Thank you, Councilmember Bass. Seeing no other comments from other members of council, we're going to move into calling the first panel of witnesses. And I think it was very poignant that Councilmember Bass raised the phrase diversity, because too often when we talk about diversity, we talk about diversity from the perspective of ethnicity or gender or sexual orientation or expression, but we don't talk about diversity in its fullest sense by recognizing diversity from a neuro perspective as well as learning or physical differences. So thank you for raising that point. And I think that's one of the key hallmarks of this conversation. And I'm glad that Councilman Brooks has brought us here this morning to have this conversation. With that, I would like to have our clerk, Mr. Iannuzzi, please call the first panel of witnesses that we have here to testify for this morning.
Commissioner Kimberly Ali, Department of Health and Human Services, and Acting Commissioner Jill Bowen from the Department of Behavioral Health and Intellectual Disability Services.
Thank you all. Please state your name for the record and proceed with your testimony.
Kimberly Ali, Commissioner from the Philadelphia Department of Human Services. Good morning, Chairperson Derek Green, Vice Chairperson Helen Gim. I am Kimberly Ali, Commissioner of the City of Philadelphia Department of Human Services. With me are my colleagues, Dr. Jill Bowen, Acting Commissioner for the Department of Behavioral Health and Intellectual Disabilities, and Donna Bailey, Chief Operating Officer of Community Behavioral Health. Thank you for this opportunity to provide testimony in response to resolution number 200269, sponsored by Council Member Kendra Brooks. Today, I will testify about the parental rights of parents with disabilities pursuant to the child welfare system, as well as a brief description of different types of services offered by DHS and DBH-IDS. I will also provide information about how DHS and DBH-IDS work together to provide a holistic array of services to families. Before I testify further, let me emphatically state, children and youth are not accepted for child welfare services, nor are they placed, nor are the parental rights of parents terminated automatically because of a parent's disability. Instead, DHS will connect parents with services to keep children in their own homes. If a child or youth cannot be maintained safely in their own homes, then DHS will ask a judge to issue an order of protective custody to remove the child or youth from their parents' care or file a dependent petition for the same purpose. However, even after removing a child or youth from their parents' care, DHS works with the family to develop a plan to reunite the child or youth with their parents or family members. DHS does not currently track the number of parents with disabilities or the rate of out-of-home placements or parental terminations specific to this population. However, our services are designed to meet the unique needs of families as well as providing an array of safety and non-safety case management services. Throughout the DHS process, from referrals to voluntary prevention services to placement and reunification, DHS, DBH-IDS, and our partners from CBH work collaboratively to support families. These critical linkages support both parents and/or children with physical, cognitive, and/or behavioral health challenges. Early connections to appropriate services for parents, children, or both mitigate the risk of family separation, enhances opportunities for reunifications, and generally support the parenting process. Since 2016, DHS priority is to right-size the system. For child welfare, this means reducing the number of children in placement with DHS, expanding prevention services, and reunifying families as soon as it is safe to do so. This effort has resulted in a significant reduction in the number of children who are in placement, 1,118 children, and a 23% reduction in the number of families receiving DHS formal child welfare services. We continue to work toward ensuring families receive services that best fit their needs, and that the children and youth only come into DHS care when there is an imminent safety threat that prevents the child or youth from remaining safely in their own homes. Children come to the attention of DHS through a report made to either the state's child line or our local hotline. We recently assessed a cohort of reports to the hotline, which found that 7 in 10 children, or 70%, are reported by a mandated source, with schools representing 38% of those reports, healthcare 20% of the reports, and social service agencies 19% of reports from mandated reporters. DHS accepts almost all child protective services reports for investigation because there is an allegation that a child or youth has been physically or sexually abused. In some instances, these reports do not meet the CPS statutory requirement and are classified as law enforcement reports only. When it comes to reports that do not allege physical or sexual abuse and are related to poverty and/or family conflict, such as allegations of deplorable housing, parent-child conflict, or truancy, to name a few, the hotline routinely refer these families to DHS prevention services. Most reports to the hotline are screened out, and many are referred for voluntary prevention services. DHS funds a variety of prevention services that are designed to support families to safely care for their children in their own homes. Our array of prevention services includes an emergency fund that provides immediate, short-term financial assistance for specific barriers, such as utility arrears, rental assistance, and home repairs. It also includes case management services through our family empowerment centers that provide case management to families for up to 90 days. If a family is accepted for service by DHS, they continue to be supported through our partnership with CBH, and specifically its Director of Clinical Consultation. The director serves as a liaison between CBH and DHS, conducts home visits, and assesses parents and families. The director works across both systems, DHS and CBH, to initiate assessments, testing, adaptive skills assessment, and identify additional resources and linkages as needed. Last year, DHS embarked on a journey with the University of Pennsylvania and Casey Family Programs to better understand and address ethno-racial disparities and disproportionality among children entering out-of-home care or placement. Of the 29,500 children who were analyzed, 93% of them were diverted from the formal child welfare system. 5% were accepted for in-home services, and 2% of the children entered placement. As part of the study, we have developed several strategies to address the overrepresentation of Black children in the child welfare system. Some of the strategies include a request of PADHS to review, critique, and enhance their mandated reporting training, as well as partnering with other agencies such as the Department of Behavioral Health, the Health Department, Office of Homeless Services, and the School District of Philadelphia to ensure that children and families receive services that prevent children from being formally accepted by DHS and/or prevent out-of-home placement. In instances where placement becomes necessary as a last resort, the child's referral information and clinical history is reviewed by a community behavioral health, CBH, clinical care manager to assist in identifying the supports that the child will need while in placement. DHS makes every effort to place children with kin. Kin is defined as anyone who knows the child or family, whether an aunt, an uncle, a cousin, a teacher, a neighbor, or family friend. All could be identified as a kinship placement. If kin are not available to care for the child, then the next consideration is foster care. To care for children with complex behavioral or medical challenges, additional training is required for kinship or foster families. In addition, other support staff such as nurses and behavioral health specialists may work with the foster or kinship parents to ensure that the child has appropriate resources according to their level of need. When a child is removed from the home, the number one goal is reunifying the family. There are numerous ways that DHS work with families to keep children in their homes or to reunify children with their parents. For parents with disabilities, one example is a program called Family School. This program is for families where the parent has low cognitive functioning. Parent attends with their young children for hands-on parenting classes. There are times when reunification cannot be achieved. Other types of permanency for children are permanent legal custodianship and adoption. When adoption becomes the goal, parental rights are terminated. Important for this committee to know is that in Pennsylvania, disability is not an automatic reason to terminate parental rights. In 2000, CBH integrated with DHS and in family court. CBH staff are located at DHS in the Central Referral Unit, family courtrooms, and at the Behavioral Health Unit in court for routine appointments and evaluations. CBH staff are also assigned to the 10 community umbrella agencies known as CUAs. These co-located staff members provide direct consultation to determine needed services, provide direct access to assessments, refer to evidence-based programs, and provide consultation to judges in court about which services are appropriate or recommended. CBH has also expanded family-based services by adding new teams that specifically serve parents and their children with intellectual disabilities. Specialized teams are also available to support families with complex medical, intellectual disabilities, and behavioral health needs. CBH also supports the Behavioral Health Forensic Evaluation Center, comprised of psychologists and psychiatrists. They are responsible for completing court-ordered comprehensive biopsychosocial evaluations for children and youth up to the age of 18. DHS and CBH have a coordinated approach to supporting parents with cognitive limitations, intellectual disabilities, physical disabilities, and co-occurring mental health or substance use disorders. Some of these supports include, but are not limited to, parent-child interaction therapy, PCIT, family-based with providers specializing in intellectual disabilities, functional family therapy, and a combination of PCIT with family school. To further strengthen its support for court-involved parents, CBH also works with DHS to provide training for many key stakeholders in our system, including Community Legal Services, the Support Center for Child Advocates, the Defender Association, as well as the CUAs. Training includes navigating the behavioral health system, including intellectual disability services, psychological and psychiatric assessments, working with parents with intellectual disabilities across multiple settings, and intellectual disability waivers and eligibility requirements. In addition to the work just described, DBH-IDS is also a key partner in prevention efforts, offering early intervention services for any child in Philadelphia at no cost to the family. Philadelphia Infant Toddler Early Intervention is administered by Intellectual Disability Services, a division of DBH-IDS. Philadelphia Infant Toddler Early Intervention is for infants and toddlers from birth to 3 and their families, and currently serves 10,000 children and families. DBH-IDS also supports the community through Intensive Behavioral Health Services, IBHS. In the fall of 2020, Behavioral Health and Rehabilitative Services and School Therapeutic Services were replaced statewide by IBHS to improve access and quality of care for children and adolescent services in the home, school, and community. Changes included increased requirements for staff training, supervision, and credentialing. The new regulations were built from community stakeholder needs, including school district principals, provider agencies, and consumers during targeted focus groups or improved access and quality of care for children, youth, and young adults. Critical to the child welfare system are the CUAs, which provides ongoing case management for both in-home and out-of-home placement DHS cases. As key supports for family and children, CUAs commit to rigorous monitoring by DHS, known as the CUA scorecard process. This DHS continuous performance management process provides ongoing guidance and technical assistance designed to improve quality of services with an annual report on outcomes that is provided publicly. The CUA scorecard is published annually and is available on our website. The CUA scorecard process has proven to be an effective method to ensure quality of services. Overall, CUAs have improved from our baseline year in 2017. Each year, we see continued progress towards quality. For example, this year, 8 of the 10 CUAs improved their overall score, as well as in the domains of visitation, court, and finance. The scorecard methodology includes domains that are weighted in terms of priority. For example, case management activities, particularly as they relate to safety and permanency, are weighted more heavily than finance or workforce. It was requested that as part of this testimony, I speak specifically about the finance and workforce domains. All CUAs except one scored 3 or above in the finance domain in FY19 and FY20. 5 CUAs increased their score in this domain between FY19 and FY20, and none decreased. There are 5 indicators used to calculate the finance domain score. The workforce domain accounts for 4% of the overall score and consists of one indicator, case manager retention rate. In FY20, one CUA had 5 bells in this domain, 6 CUAs had 2 bells, and 3 CUAs had 1 bell. We are working to make this domain more robust. One limitation of this domain is that it does not account for positive moves such as promotions. We will continue to work with CUAs to address challenges and to share best practices across all domains as we work together to strengthen child welfare practice. DHS would not be able to do this work without our partners at the CUAs, community-based providers, DBH-IDS, and CBH, and we are committed to improving outcomes for the children, youth, and families who are connected to our systems. In closing, I would like to thank council members for continued support. The family situations presented to DHS are often complex and challenging, but I am confident that our priority to continue right-sizing the system and focusing on prevention services will have a positive impact on those we serve. Thank you.
Thank you, Department of Human Services Commissioner Ms. Ali, for your testimony. We'll take questions from members of the committee after all of the witnesses testify. I want to note for the record that we're also been joined by Councilmember Helen Gim, and the fact that we have members of the General Assembly here. I want to give them an opportunity to testify and give a comment I'd like to proceed in this order. State Representative Morgan Cephas, followed by State Representative Dan Miller, followed by State Representative Elizabeth Fiedler. So if those members of the General Assembly could present their testimony or opening comments in that order, and then after Representative Fiedler finishes her commentary, we'll then hear from Department of Behavioral Health and Intellectual Disability Services Commissioner Dr. Jill Bowen.
Mr. Chair.
Yes.
Mr. Chair, point of information. This is Councilmember Catherine Gilmore Richardson. I wanted to note that I was here for the record. Thank you so much.
Thank you so much. With that, I'd like to hear from Representative Cephas. Congratulations to you, as well as Representative Miller and Representative Fiedler on your reelection. Looking forward to great things as you wrap up the state budget in the coming days. And good morning.
Good morning, Chairman, and thank you so much for your congratulatory remarks. As we all know, this year has been a bit of a whirlwind, to put that lightly, but we are extremely excited to not only end this election cycle, but also to have a new group of dynamic representation in our leadership on the Democratic House side. Beyond excited to be able to have not just our minority leader and our whip to be from the city of Philadelphia, but also excited for this collaboration. And I do want to thank you, Councilmember Brooks, for inviting myself as well as my colleagues. I'm excited to see not just Representative Fiedler, but also our new chair, Dan Miller from out of Western Pennsylvania. He has led the charge on this topic since I've been in the House and has done a tremendous job. One of the things I am beyond excited about is as we move forward out of this pandemic, as we try to help our economy rebound, as we go into new leadership, not just in the General Assembly, but also in the White House, it's going to be critical that we are working more collaboratively on these types of issues. So as we spend down COVID-19 dollars, as we draft budgets, we need to ensure that we're, again, able to leverage dollars that we're not just spending on the state level, but also the city level. And the way that we do that is by continuing to have this type of conversation, this level of dialogue to see what is it that we can do here on the local level to protect this population, but then also what is it that we can do around moving policy, again, making strategic investments in our local municipalities that will help move the needle on these types of conversations. So I want to, again, thank you for having the forethought on inviting us and allowing us to participate in today's discussion. And I just extremely am looking forward to how we can work more collaboratively together to do as much as we can for this population. So again, thank you for having me and my colleagues, and I look forward to today's conversation.
Thank you, Representative Cephas. Now I'd like to recognize Representative Miller and then Representative Fiedler.
Thank you and good morning. Good morning. Look, I very much appreciate the invite. I want to thank all of you for extending the courtesy, not only of your words, but your invite, and not only of your invite, of course, but your fantastic comments and work that I've been picking up on today. I definitely appreciate being here with my great colleagues as well. So good to see them. I'll tell you, Philly strongly represented, not only back home, but in Harrisburg. And I can tell you from Pittsburgh, that I very much enjoy our collaboration and work. We need to do more, especially on issues that unite us like this. Look, you guys are focusing on a fantastic and a much needed set of issues to discuss. I know that a lot of you come into it with immense personal connection, passion, sincerity on these goals. We in Harrisburg want to work with you in advancement of these issues. I can tell you on the disability front, much like my colleagues that are here too, we've been struggling to help. We want to help. We need to help more. So the work that you're doing here and the discussions that you have, I'm interested to see how everything kind of comes together. I love it. the way you guys are sort of leading some of these discussions. I'm going to be taking notes and bringing it back to Pittsburgh as well, because we got to do more. Look, there are people with disabilities in every section of the state, in every section of life, in every industry, and in every home. No matter where we go with it, there is a connection somewhere, somehow, to a friend who you work with, a family member who you love, and anything along the lines. There are those connections. All too often, especially in times of trouble, people with disabilities have been pushed to the side. In a lot of ways, they're asked to sacrifice too much. It's disproportionate. It has never been the time. For too many people with disabilities, we talk about, well, what can we get back to life before COVID? Life before COVID for too many people with disabilities wasn't the promised land then, right? So we need to make it better going forward, right? This is what we have to do. So this includes the kids who are coming up with disabilities, as much as it includes adults with disabilities, parents with disabilities, right? We do need to talk about all these issues. I think it might have been Ms. Brooks, I think, may have mentioned a comment in relation to the parenting styles and the different how people with disabilities raise their children, and how understanding needs to be elevated into certain areas for that too. How we can be more supportive of that, both in schools and occasionally too when county agencies are involved that come across too. We need better understanding across the board with it. I can tell you again with it that your work is very much appreciated, that we look forward to seeing everything that you generate and our growing partnership on these issues. We plan on making disability issues even more of an issue for us in Harrisburg. We are now in the midst, of course, of a budget to which I know my colleagues and I are jumping in and out of today. But I can tell you, we still struggle because we want to find more support. And it's difficult. We need to get to the point where politicians are not just taking pictures of people with disabilities, but they're voting for people with disabilities. And those voices are magnified and lifted in every corner. So look, we thank you. I know I thank you very much for your work. And I look forward again to continuing to listen to see what you generate. I can tell you that both in my office as caucus chair and in every office of Philadelphia reps, you have an open door. We want to work with you. We want to continue this partnership. And we thank you very much for the invite today.
Thank you, Representative Miller. It's good to see you again, and thank you for your leadership on this important issue. As I said to you last time we saw each other virtually, you're still representing New York, even though you represent Pittsburgh. So I'll let that go. Representative Fiedler, the floor is yours. Thank you for being with us this morning.
Thank you, Mr. Chair, and great to see my colleagues, Representatives Miller and Cephas, on the call. Thank you to all of the council members, and in particular to Council Member Brooks for the invitation to attend this, and to the chair as well. I will just echo some of the comments that have been made previously, and I think Representative Miller makes an important point that many of us are struggling with real-life challenges now during COVID. Many of our neighbors are. And that is real. And at the same time, we need to recognize that for many people with disabilities, the situation that existed, the daily life challenges that existed, the way in which our society treated people before COVID was not perfect. It was far from perfect. And it was far from the goal that we all have. So whether we're talking about the daily challenges that people face or some of the even bigger life-altering and potentially life-changing and life-ending consequences of the way that our society undervalues many people and does not provide sufficient support and understanding is incredibly important as we move forward and hopefully find a way to, recognize that this transcends geography, obviously across the state and the Commonwealth. This transcends politics and political affiliation. And this is really something that impacts all of our families, whether it's someone directly in our family or someone we hold dear who feels like a family member, even if they're not a blood relative. So just want to thank all of the council members for holding this hearing on this important topic. And I'm very glad to be here to listen, to learn, and certainly, as Representatives Miller and Cephas pointed out, really hoping that we can work together on this on a city-state front, collaborative front, to best serve the people we represent. Thank you.
Thank you, Representative Fiedler. Also, just want to thank you for your support for your new colleague, Jess Benham, who's coming to the General Assembly, who is a disability rights activist and someone who's also on the autism spectrum, the first person to be elected to the General Assembly from the autism perspective. So thank you for your support of her. Clearly, your actions speak a lot louder than your incredible words in helping her to come to the General Assembly. I think that echoes the spirit of this committee and the work that you do and the work of what we're trying to do this morning. So thank you.
Absolutely. And I know incoming Representative Benham sends her regards and is in some orientation meetings now that she's coming into the House, but very much wishes she could be here and looks forward to working with you all.
Thank you. Now we're going to shift to Dr. Jill Bowen, who is the Commissioner of the Department of Behavioral Health and Intellectual Disability Services. Dr. Bowen, are you available to present your testimony?
So good morning, Chairperson Derek Green, Vice Chairperson Helen Gammon, members of the Committee on People with Disabilities and Special Needs. I am Dr. Jill Bowen, Acting Commissioner of the Department of Behavioral Health and Intellectual Disabilities Services, DBH-IDS. Thank you for this opportunity to give testimony in response to resolution number 200269, sponsored by Councilperson Kendra Brooks. As per agreement and in alignment with the manner in which DHS, DBH-IDS, and CBH coordinate our efforts on the ground in these relevant efforts, testimony was integrated this morning and provided to you by Commissioner Ali, so I will just make a few comments. DBH-IDS services and supports promote well-being for the entire family unit, including critical linkages that support both parents and or children with physical, cognitive, and or behavioral health challenges. DBH-IDS's efforts are aimed at supporting families, preventing out-of-home placements, and supporting reunifications whenever possible through a care coordination approach and providing assessments, skill building, and connections to services and treatments. DBH-IDS remains committed to the children, parents, and families of Philadelphia. We demonstrate this commitment by continued integration with systems that allow us to identify and address social determinants of health proactively. We will continue to collaborate with all organizations and entities to develop further and enhance awareness of available resources for individuals and families across Philadelphia. We will continue to support our deep partnerships with DHS and the School District of Philadelphia to ensure students and families have access to the support and services they need. We are thankful to the members of City Council for their advocacy for resources for parents with disabilities. We are fortunate to have your support advocating for resources on behalf of individuals with intellectual disabilities and behavioral health concerns. I welcome the opportunity to provide additional information about the content shared in the testimony by Commissioner Ali and my statements here. And I, along with my colleague Donna Bailey, Chief Operating Officer of CBH, are here along with Commissioner Ali, and we are happy to answer any questions at this time. Thank you.
Thank you. I will note that my understanding the commissioners have a hard stop at 11:30. So I have a few questions and I will open it up for members of the committee. Commissioner Ali, I just wanted to follow up in your testimony when you made reference to an imminent threat, that many of the calls that you get regarding imminent threats are coming from a mandated source. So I wanted to get some perspective. How do you define an imminent threat?
Yes.
Or how is it defined?
So reports come into our hotlines as I testify. So either the state child line or the DHS hotline. And they come in, as I indicated, most of them come in by a mandated reporter, which is 70% of the reports that come into the hotline come in by a mandated reporter. And so how we define what is an imminent safety threat is based on the Child Protective Services law, and is also based on hotline guided decision making, which is a structured tool that our hotline uses to determine whether or not a child has risen to the allegation of sexual abuse or physical abuse. So that would constitute a CPS report. In those situations, we do not have any or very limited discretion in terms of not accepting those particular reports because of the allegation of physical abuse and sexual abuse, which will certainly be imminent in terms of a safety threat to the child. However, when you talk about general protective services reports, that may not necessarily be an imminent threat. In those situations, we do have some discretion and we still use hotline guided decision making, but we oftentimes refer those particular families to prevention services. As my testimony indicated, we looked at over 29,500 children to determine where did they end up, if you will, when a report came into the hotline. And 93% of those children were actually diverted from the formal child welfare system, and many of which received prevention services.
Thank you for that. I also wanted to get some more perspective, and I think Councilmember Brooks highlighted this in her opening remarks, that, too often this society looks at things from an ableist perspective. So I wanted to get some information how you provide an outreach to parents and caregivers in particular that have a physical learning difference. Because of that ableist perspective, people have a real fear and concern that if they are looking for additional supports to help in their household, that may open the door for them to be separated from their children. So what steps is the city taking to help provide services in a way that makes people really feel comfortable that they can reach out for some aid, but also not have that situation occur where they're going to lose their child just because they reached out for some information or assistance?
So thanks for that question. And just to be completely transparent, the city, in particular the Department of Human Services, has a ways to go in reference to ensuring that the community is not fearful of calling in and asking for some support. As I indicated, we did embark on a journey with the University of Pennsylvania to look at disproportionality in the child welfare system. And I thank Councilmember Brooks, because when you talk about diversity, we also need to look at it with a different lens in terms of young people and parents with disabilities. So we will take that back. However, one of the things that we are beginning, this is preliminary conversations, is around creating a warm line, if you will. DHS has done a great job. PADHS has done a great job with flooding the community, flooding mandated reporters, if you will, with the hotline. And so automatically when people hear the DHS hotline or child line, they believe report to DHS. Report to DHS, unfortunately, for people, make them fearful. So we want to create another line so that mandated reporters, families know that we are here to offer support versus you calling in a report to the DHS hotline. Again, these are preliminary conversations that we are having. One of the other conversations we've had with PADHS, as well as with our colleagues from Casely Family Programs, is around reframing mandated reporters, still having mandated reporters calling reports as it relates to sexual abuse and physical abuse. But can we do some reframing around mandated supporters in that a school principal, if you will, or a teacher or someone in the community can call a particular warm line to ask for support services as opposed to the DHS hotline? Again, very preliminary conversations. We just finished the first phase of the ethno-racial disproportionality study, and we have a couple more phases to do, but very preliminary in terms of getting the word out to the community so that communities can come to us for support.
Thank you for that response. Can you provide, I know you're in the early stages of this, but can you provide some type of range of time perspective, and will the same level of resources regarding reporting going to the mandated reporters also be provided to those in neighborhoods throughout the city of Philadelphia about resources and support?
Yeah, so our time frame, we just loosely put FY22. What we believe that we are going to do, even at PADHS, we understand that they have the whole state of Pennsylvania. So we have been having some conversations with, we know that the school district of Philadelphia, as well as charter schools, so the schools report the most in terms of their role as mandated reporters, as well as hospitals. So what we want to do is, even if we just target the mandated reporters in Philadelphia, so that we can educate them on taking a more supportive role, contacting the warm line, and that we can connect the family with services. So we say for fiscal year 22.
Okay. And as I close, what's going to be the financial commitment to this initiative? Right now, various departments are going through the budget process with our city budget director, Marissa Waxman, as well as the finance director, Rob DeBow. So what type of resources is your organization going to commit to that from a budgetary standpoint?
So I can tell you about the current commitment. As you know, with this unprecedented times, things change. However, I will say, as a city, we have been really intentional about ensuring that any prevention service, particularly prevention services that will divert a child or family from the child welfare system, continues to be funded. So to date, we allocated $95 million to prevention funding.
Okay. Thank you. With that, I know Councilmember Brooks has questions as well. If other members have questions, please indicate in the chat feature.
Thank you, Chairperson. I want to first commend DHS for taking the initiative to reduce the rate of child removals and for their initial success in this work. I hope that our city's child removal rates continue to decrease, as we all agree that it's still certainly too high. But right now, I want to focus particularly on parents with disability. And I want to make sure that I'm clear on what you said, that DHS does not track the outcomes for parents with disability. Am I correct?
Yes, and particularly as it relates to the termination of parental rights. So as it relates to the resolution. So I am unable in our database to indicate that a parent had a specific disability and that then it led to the termination of parental rights. We track the child in terms of disabilities, but not the parents. So because you brought it to our attention, this is certainly something that we are exploring. What we do have available to us, though, Councilmember Brooks, and we just actually pulled that data, so we will follow the trajectory to determine whether or not it led to the termination of parental rights. We looked at over 40,000 children who were referred to the DHS hotline from March 2019 until March 2020. And we looked at the allegation code. So I do need to do a disclaimer in that the allegation code doesn't necessarily necessitate a report. And so when we look at the category for intellectual disabilities, it represented 1% of the 40,000 children. So it was 249 children and parents, so combined. And so we will look at those 249 allegations to determine where did they end up in our system. But this was a recent data pull as a result of our conversation that we had last week.
Thank you. That information is very helpful. My next question is in reference to what about requests for ADA accommodations? Is that tracked? And do we have any data on a number of families that requested accommodations under ADA? And is it possible to track that?
So we don't track the number of families who make an ADA accommodation. We do track it internally in reference to our staff, but not in reference to parents.
The reason I'm asking is because without tracking, it's nowhere to be able to have it as a clear resource. So if another parent came, it's like creating a wheel over and over again. So if we were able to track it, we'll be able to have added to the continuum of services for other parents that requested that same information. So at some level of uniformity in services and resources. So every time, even if you said it was like, the number you said was like 249, each one of those cases would have required for someone to go back, so we can want it to have a stronger system to support folks with disabilities.
No, and I agree. I agree with you in terms of the importance of tracking. And you certainly help elevate this in terms of the awareness based on our conversation. So we are looking at ways to track parents moving forward.
Okay, and earlier you mentioned some information that you did track. Is there any way that my staff could get a copy, some information about that? I'm trying to think of my former question. I'll email it to you, but you did say you tracked information. And my next question is about CUAs. What training does CUA workers, what do they receive about supports or to evaluate the capabilities and the needs of parents with disabilities?
So I'll start this off, and then I will defer to my colleague from CBH. So we actually partner with Community Behavioral Health, their director of clinical coordination, who train the CUAs on understanding and how to work with parents with intellectual disabilities or mental health issues. In addition to training the CUAs on that, they also train them on psychological evaluations and psychiatric evaluations, particularly around the recommendations and the importance of supporting, the family or the child in terms of meeting those recommendations. They also train them on the importance of creating a network. So a network for the family so that the parent can have support, a supportive network in order to keep their child with them in their home and to be able to navigate services. I will defer to Donna Bailey to determine if in fact she wanted also to answer some additional questions around the training.
So good morning, everyone. Good morning, Chairman Green, members of City Council, other elected officials and guests. I'm Donna Bailey. I'm the Chief Operating Officer here at Community Behavioral Health. Thank you, Commissioner Ali. You did a wonderful job summarizing some of the services and supports that we do as far as our clinical care managers who work with the CUA teams. In addition to what Commissioner Ali stated, I would also add that our care managers who work specifically with the CUA teams are also doing on-site clinical consultation with the DHS team and families. They're participating in family conferences. They're working with the families on service plans related to social determinants of health, things like food insecurity, transportation, housing, so that we can take a holistic approach at what the family needs.
Thank you. What about some of the court-appointed psychologists and the other folks that are doing the work? What level of training do they have specifically around working with parents with special needs? And is there opportunities for advisory board or something for parents with disability to be a part of that process? Because their parenting techniques are unique to them. And, being an able-bodied person, sometimes we don't understand the complexity of the skill set that is required. So are there folks or parents with disabilities that are part of this conversation or leading towards this training? And is there an opportunity for that to happen?
I'll defer to you, Donna, in terms of the training that the psychologists and psychiatrists receive, particularly around your behavioral health evaluation unit that is at court, and whether or not I do know that you use family members and peer support, or are they involved with any of the training?
So I would say probably currently they're not involved with trainings. That's certainly an area of opportunity for us. We do have, as Commissioner Ali stated earlier, staff who are in the courtroom and who work with the judges, the child advocates, and the other supports who are in the courtroom for children and families. And we do a lot of work with that group of treatment and service providers and justice systems providers. But I would say that this is an opportunity for us to engage people who are actually having this experience in those training opportunities.
And if I may add that DBH IDS's advisory boards includes the Vision for Equality, and they are very helpful. That includes parents of individuals with intellectual disabilities, and it's very helpful in terms of providing guidance there.
Dr. Bowman, just for clarity, so you said the parents of individuals with disabilities, but are there any people with actual disabilities that are parents that are a part of it?
I'm not sure on that board, but we certainly do, and other boards have folks with who are have their own challenges and who participate and help us guide us with some of our programming.
Thank you for that. I have some questions around the COOA scorecard that you mentioned. Is family and parent feedback included on the COOA scorecards?
So parents and family feedback is not included on the scorecard. What it is included is in, we do quality visitation reviews in which a DHS social worker contacts the family, so contacts the parent, contacts the young person, and then they provide them with feedback in terms of the services that they receive, any supports that they need, whether or not the COOA case manager is addressing the needs of the family, whether or not they understand what their case plan is, and if they need some additional supportive services. So that is actually a standalone document that we use, which is quality visitation review. We are looking at how to incorporate that into our COOA scorecard.
I'm having connectivity issues, so I just went off camera briefly. Virtual learning and working is sometimes a challenge. So my concern is that if we aren't tracking the outcomes for families with disabilities, and we don't track who is requesting accommodations, so we don't have a clear snapshots of what families need if we're not getting their feedback in the end. And if we had some mechanism for parents and families and parents with disabilities to have feedback, it would be a way for them to kind of address their own concerns and to make the services more accessible to them, and even more, and increase their ability and desire to utilize them, to break down some of the fear barrier that, we will hear in some upcoming testimony. So that's my concern. And I would like to know, is that something that we can begin to explore as a city to make sure that that's happening?
Absolutely, Councilmember Brooks. As I indicated, we hear, your concern. Certainly, we need to do a better job, although we do get the input of many, many family members, many, many parents. We do not track whether or not their concerns are related to a disability or whether or not they have a disability. So I have elevated this to our performance management and technology division at DHS that is responsible for, our monitoring, our evaluation, and our outcomes. And we will be having further conversations about how do we go about tracking this.
Thank you so much, Commissioner. I have one other question, sure, and it's related, but kind of not related. But what is the current or the standard caseload for a COOA caseworker here in Philadelphia?
So the caseload size in which the department pays for is 10 families to one COOA case manager. However, when we look at the average is somewhere around 12 families to one COOA case manager. This is certainly below the state average, in that the state indicates that a worker can have up to 30 families. We recognize that the unique and challenging needs of families, it is virtually impossible to juggle a caseload size of that. So that's why the city DHS supports a 10 to 1 ratio. However, we are hovering around about 12 to 1.
Thank you so much, Commissioner. Thank you so much, Dr. Bowman and your team.
Thank you. And Councilmember Brooks, that concludes your questions?
Yes.
Yes, thank you. Just wanted to follow up on a question I had. This Monday, let me just make sure I have all my information in front of me. This Monday, the administration is actually providing a briefing to members of City Council regarding the ADA transition plan. And I wanted to get some perspective on your department's involvement in that. My understanding, the goal of the transition plan is for all city facilities and programs to ensure non-discriminatory access to all city services and programs under the Americans with Disability Act. And so I wanted to get some perspective on what engagement your departments may have had with the Directive 88 compliance that's within the Mayor's Office of People with Disabilities. That's within the Mayor's Office on People with Disabilities.
So, Council Member Green, I don't know anything about that for this coming Monday. However, if I'm invited, I certainly would like to participate or have someone from my team to participate. So I don't know anything about it.
Well, my question wasn't so much about your ability to participate on Monday. My understanding that's going to be presented by the mayor's staff in reference to what the transition plan is. And I believe the initial focus is primarily on city buildings for accessibility. But since this conversation is also talking about programs and services, and we had a kind of a detailed perspective on what type of outreach that your department is going to provide, that whole warm hotline to provide more services for those parents with disabilities. Just want to get some perspective if you've had any involvement, and if not, I think that's an opportunity to reach out, considering you're talking FY22, to kind of give some information about what your department is doing in reference to providing services.
Agreed. So I will definitely reach out. But this is the first I'm hearing of it. Doesn't mean that someone else in my department, I will hope that they reached out to my Deputy of Administration and Management. They handled the ADA request. Building management is also under her, but I haven't had a conversation. So I will follow up accordingly.
Okay. I totally understand. Just want to put that on your radar. Seeing no other questions from members of council for this panel, I thank all of you for being here, for your testimony. There may be some additional questions for both Commissioner Ali, as well as Donna Bailey from Community Behavioral Health, as well as Dr. Bowen from Department of Behavioral Health and Intellectual Disability Services. I know you have to leave around 11:30, but if you could just stay for a short period of time in case there's some additional follow-up questions that need to be directed to any of you. With that, Mr. Iannuzzi, if you could read the names of the witnesses for our next panel.
Latoya Maddox from Liberty Resources, and Dominique Goll, also from Liberty Resources.
I want to thank you for being here. If you can state your name for the record and then proceed with your testimony.
Latoya Maddox. Good morning, City Council members, senators, and others. Council members Derek Green and Kendra Brooks, thank you for having this hearing and allowing me and others to testify on behalf of parents with disabilities who have children with and without disabilities. Again, my name is Latoya Maddox. I work full-time for Liberty Resources, Inc. I'm an independent living specialist, and I co-facilitate a social support group, Mama Chronicles. We also have a virtual platform, Mama Chronicles 2, across the states. Each of these groups are made up of mothers with disabilities who have children with and without disabilities. We come together for peer support and community outreach on collective advocacy for disability initiatives that better the lives of our families. Dominique Howe and I also assist fathers with disabilities in the same sense, just more on the individual. It's an as-need basis because they don't call as much or reach out as much. I have been physically disabled all my life, and I, along with my siblings, ended up in the foster care system when I was 6. Removing me not only from my siblings, but my entire family has had long-lasting effects, which I still deal with today. There were no courts back in the late 80s and throughout the 90s. I remember having a caseworker from the Juvenile Justice Center who listened to me when my needs were not being met. JJC let me have a say in my ideal home, in the ideal home I wanted to stay. This is what DHS and CUA should do more of. Listen to us, the disabled experts. We know what our needs are. I aged out of the system at 18 and moved back to Philly, where I stayed at English House for a year and a half. And through Liberty Resource Nursing Home Transition Program, I was able to get my first apartment and have been living on my own since 2004. I became a mother in 2011, and has it been the easiest? No, not always. But reaching out for assistance from places like DHS was a no for me. We are told DHS and CORES are or can assist. However, it is unfortunately not uncommon for parents with disabilities like myself and others that I support who express the complete opposite. Their frustration and experience with the lack of citywide services, which are supposed to support them and work on providing resources before intervention, falls short. DHS and CORES are a service provider and should use an alternative like places like Liberty Resources so that the parent with the disability can also have an advocate that identifies as a person with a disability, because it is the LRI's main philosophy. LRI's main philosophy is community integration. Advocacy is one of our 5 core services which we provide. As we will hear, some parents and prospective parents yearn to expand and start their families. There are children with disabilities being sent to institutions and having to stay there until they age out or longer, when they could be matched with a family with parents who have a disability or have children who have disabilities. We need to implement real change by creating pathways for parents and prospective parents of disability in the foster care system. What the heck? Okay, sorry. This could begin by educating providers on the systematic biases and ways to end them. Also using resources and the tools already in place to make changes to your organizational policies. This includes allowing us to have a voice on the policies and regulations designated to support our livelihood. Adequate representation looks like a system that uplifts family unity. Finally, in Philadelphia and PA, as long as the child is not in immediate danger, we need legislation that shows a more hands-off approach and allows parents and prospective parents with disabilities to lead the way when it comes to parental guidance. Thank you.
Thank you, Ms. Maddox. And now we'll have the next witness testify. Ms. Dominique Lowell.
It's Howell.
Oh, Howell, sorry. Howell, sorry.
It's okay. It's okay. Hold on 1 second. I have to pop my phone.
Take your time.
My computer is acting one. Unfortunately. Testimony back up. Okay, so as I said, my name is Dominique Howell. So my testimony is, good morning, council members. First and foremost, I would like to thank you all for being present today and taking the time today to listen. Special thanks to Council Member Kendra Brooks, and her office staff for developing this resolution for people with disabilities and special needs. My name is Dominique Howell, and I work for Liberty Resources, Inc. as an independent living specialist. Not only am I a disability advocate, but a mother with a disability. My journey with parenthood and advocacy began when I gave birth to my child in 2014. Unfortunately, my negative experience is far too common, and unless there are changes made by the powers that be, like you are listening today, it will not be the last. Parents with disabilities often face discrimination in parenting because of their perceived fitness as parents being questioned by child welfare workers and support staff. Because of this ongoing discrimination and lack of knowledge from the powers that be, I created a support and advocacy group for mothers with disabilities and mothers who have disabled children called Mama Chronicles 2. This support and advocacy group not only supports our members, but the community as well, where we focus on community outreach and fundraising for communities we serve. My story of disability discrimination began after major complications during pregnancy. I had to be on hospital bed rest for the last 2 months of my last trimester. Once my daughter was born, I had to stay in the hospital for almost a week. During that week, I was approached by doctors, hospital social workers, and a DHS worker who all stated that they felt it best my daughter be placed in the system. Their reasons were based on my pregnancy complications, but more so my physical disability. I explained to each person that I spoke with that that no one here knew my baseline capabilities before pregnancy, which meant they did not have enough information to adequately judge my ability to parent. But no matter what, I or advocates who testified on behalf of my physical abilities said the doctors and social workers were adamantly against my daughter leaving the hospital with me. They further explained that the only way I would be able to take my daughter home is if I found someone to sign documentation that stated the said person would make sure that they would care for, in quotations, and watch, in quotation, my child and I. The hospital and DHS said that they would only accept this document if 2 people were willing to sign. I then asked my god sister and my home care attendant who worked for me during this time to sign the document. Without their signatures, I would have not been able to take my daughter home from the hospital. 1 second, I have to scroll down. Computer is wonky. I felt and still feel that there was not enough information to make any conclusions on my parenting. My conclusion and that of my friends and family is that I was threatened with removal because of my disability. As an advocate, I have seen that my story is not always the outcome for parents. However, I have often seen a lack of consistency or uniformity that makes it difficult for parents with disabilities and their advocates to navigate the systems that are put in place to help. There must be a change in the culture around the support services in the city. Unfortunately, in 2017, my daughter and I got evicted due to no fault of our own. As most of you can imagine, the experience left a huge impact on our lives, more specifically, our time in the shelter system. My daughter now has lasting effects from her trauma of being homeless, so much so that I have been trying to get help from any and every mental health agency that I could for the past 2 years. Although I have tried to find support, my concerns are left unheard, and I often find that people are not listening to my needs. I truly believe, as an advocate, this is due to discrimination because of my race and disability, which has in turn led me to take my daughter to the CRC twice in the past few months. I have found that many service providers turn me and my child away instead of listening, leading her not being able to get the help she needs without having to resort to drastic pleas for help. Okay. It is my personal and professional opinion that the idea of CUAs can be fundamental and beneficial. However, I also feel that the way they are designed and operated have been a disservice to the families they are called to help, especially families, those families who have children or are disabled, children with disabilities or are disabled. Their lack of knowledge and professionalism when helping people who have disabilities is disheartening and infuriating because these families need services the same way the families without disabilities do. The stigmas and judgments against parents with disabilities must end. Cities, city agencies, and hospital systems alike must educate themselves on disabilities, disability organizations, and the resources that are available to people with disabilities. As a city, we need to ensure the voices of parents are heard. And in PA, we need legislation that specifically protects the rights of parents with disabilities. If we all come together to change the inner workings of this system, more children with disabilities, as well as their parents with disabilities, will be able to stay together and have the family unity they deserve. Thank you.
Thank you, Ms. Howell and Ms. Maddox, for not only your work at Liberty Resources, who I've worked with for a long time, but really for your voice and advocacy, which goes beyond just your day-to-day work, but your work in lifting up your voice and giving strength and support for others to do the same, especially in reference to your Mama Chronicles work. So thank you for being here this morning. Is there any questions from members of the committee for this panel?
I have a question.
Okay. Feel free, Councilmember Brooks.
Yes, so much. I want to start by thanking both Dominique and LaToya for guiding my understanding of people with disability for over the last 20 years and being a major part of my understanding on what it's like to be a supporter and an ally of people with disability, especially young people with disabilities, and challenging everything that I did professionally and making me throw the book out the door and recreate something just for you ladies. And I'm still committed to doing that for you in my new position. So thank you. And I want to say that I'm very proud of the work that you continue to do for other people. My question is first for LaToya. You spoke about both your experiences as a person, as a young person, and as a parent with disabilities. And I know that you are a leader in the disability justice world. So I was wondering if you could share your vision for the city about how to get more young people with disabilities living in communities with loving parents.
Well, I have to end the stigma, right? So there's people with disabilities, including myself, who also would like to adopt. They need to create a system where we're not judged. Like, you have to be transparent from the door. And if there's something that we can't do the way that the system says we have to do it, but we know how to do it our way, then let us do it. Let us show you how we do things our way. Yeah, I may not be able to perform CPR, but I always have somebody in my house that can assist, and I can tell them how to give a child CPR. So we have to, let the young people know, like the DHS, Miss Ali said, their DHS is turning the curve, but we also need to be at the table, and the young folks need to be able to see that we're at the table. They don't just need to call us and have us in the background. We need to be in the meetings sometimes, and it doesn't have to be always, because again, Dominique and I, we do have our own children that we have to raise, but the younger folk, like not younger folks, the other parents who are going through similar things need to learn that it's okay to reach out, and DHS will only intervene if they see a critical need, but the stigma, it all stems from the stigma. So once the stigma is, it won't be gone tomorrow. So once the stigma is like close to being far gone, I think more younger people and parents with disabilities will be more willing to reach out to systems like DHS, but I think DHS also misses the information, because the Center for Independent Living has been around since the 70s, since the 70s. Like Liberty Resources has been around for 40 years. I'm 37 years old. Had they reached out to Liberty Resources been more a citywide place where all organizations knew about, then I probably wouldn't have went to an institution. I would have been placed with with another family who was willing to take in a disabled child. And there are people who want this, but again, the stigma has to end.
Thank you so much, LaToya. My next question is for Dominique. As an advocate, I know that you speak with many parents with disabilities on a daily basis. Could you please share a little bit more about how you help parents with disabilities navigate the services throughout the city? And what are some of the common issues parents come and seek help for? You're on mute.
Fortunately. Okay, so we see resources for abuse, with domestic violence. We see resources for housing. We see resources for food, and from social workers. Their social workers call us for help with them, and because they're like, we don't want to get DHS involved because we know of the stigma and the disparity and the discrimination behind it. So we're coming for you first. So I think that the biggest thing is that each organization, DHS, CBH, all the CUAs, hospitals alike, they need to work together so that one person doesn't have to just come to Liberty Resources for the answers, because we're a resource center and we have connections. But if a social worker could just go to DHS and say, look, it's not that I feel that the family is in a dire situation where the child needs to be put away. They just need things put in place. Can you help us? It would be better. So that's the kind of things that we deal with. And keeping their children, right now, that's what we're dealing with a lot right now. We have 2 consumers that we are dealing with that has custody issues, and it's based off of their lack of ability to parent because of their preconceived notions while they were pregnant. So it's unfortunate, but that's a lot what we deal with.
So when you're recommending parents to seek assistance from outside agencies, what kind of things do you consider?
As far as what exactly?
Like in terms of when you get the calls from the social workers or a hospital about, outside agencies, what are the things that you consider when you're connecting parents to the resources to prevent some of the things that come with stigma? Like, how do you determine which agencies will better be able to serve your parents with disabilities and will have a positive outcome?
So first and foremost, we educate whoever calls us about home and community-based services, which, are available, and all the services that are available to disabled people and their children alike. That's the first thing that we do. Because as you know, as LaToya has stated, our primary goal at Liberty Resources is always community integration. So we educate about the rights that they have. That's number one. So if their rights are being violated, we always connect them to Disability Rights Network or Legal Clinic for the Disabled. Those are our go-tos. And sometimes, depending on the situation, Community Legal Services. Those are our 3 top agencies.
Thank you so much, Dominique, for your answering those questions. That concludes.
Thank you,
Councilmember Green.
Thank you for your questions. Any additional questions for this panel from members of council? Seeing none, thank you both for being here this morning, for your advocacy and all the great work that you do for our city and all its constituents. Mr. Iannuzzi, if you could read the names of the witnesses for the next panel. Witnesses, please state your name for the record and then proceed with your testimony.
Jody Hulam, Clinton Crittenden, Catherine Thornton.
Okay, I'll start. My name is Catherine Thornton, and I want to thank the panel for allowing me to tell my story. One moment, I'm sorry. Okay, my name is Catherine Thornton, and I am here to testify about the rights of parents with disabilities. I have 4 siblings, 3 of which, including myself, have been diagnosed with a hereditary disease called spinal muscular atrophy, which causes a weakness of the upper and lower extremities. The disease affected each of my siblings differently as far as progression. Due to my disability's progression, I began using a wheelchair for mobility purposes at the age of 14. Presently, I am no longer independent, but require home and community-based services such as an attendant. However, I am still able to live a productive life that includes working full-time and raising 4 children, 3 of which I am raising. 1 is mine biologically, and 1 is adopted, and 2 are my great nieces. As you can see, even with my disability, I can do it all and have, thankfully, not experienced disability discrimination as a parent. When I got married, I longed to be a mother. My husband and I tried for many years. Unfortunately, were not successful. My husband and I discussed becoming a foster parent or foster parents. He was very supportive of my decision and wanted me to be happy. We started our foster parenting journey by finding an agency called Friendship House. We completed trainings and several classes, wrote a biography about ourselves, and got our house in order to complete our certification. At that time, my husband and I were applying to become parents. There were no coolers involved. During the time of my approval of becoming a foster parent, I found out I was pregnant. So this was the most exciting news of my life, and my husband was overjoyed. The great news caused me to put being a foster parent on hold because I was high risk and I needed to focus on a healthy pregnancy for myself. Thankfully, my pregnancy went well with no issues, and I had my first child by C-section in 2002. I had a technique when caring for my daughter. So I would lay her between my legs when I was in bed and feed and change her. When she was in close proximity of my body, it was easier for me to care for her. I had a social worker from the hospital visit during my stay who discussed my plans and support. And she never jumped to any conclusions about my fitness to be a parent. I was lucky to have friends, family that came to visit us. And my husband was there on a daily basis, and I was hospitalized for 7 days because of the C-section. He was there every single day, stayed the night. So when my daughter was 5 years old, she asked for a sibling. Well, I knew in my mind that that was not happening. I was 39 at the time, so I began the process again with the same foster agency to be a foster parent. CUAS was not around at this time. I dealt directly with the agency. I went through the application process again and was given 2 foster children, 2 girls, around the same time. Tomiko was my first foster child, and she came to me to live with me when she was 5 years old. And 6 months later, they asked me to foster another girl, and her name was Betty. It was the greatest joy to be a mother and a guardian of 3 children. A handful, but a joy. I did as much as I could with the girls, including trips to the zoo, museums. I tried to take them everywhere. We went everywhere. I was blessed because I lived across the street from my mother and sister. They were a great support system for the girls and myself. The girls attended a school that was about a block away from my apartment, and I had a neighbor assist me with picking them up and dropping them off from school so I could still work full time. 2 years later, I was able to purchase a 3-story house for my family. And this was my greatest accomplishment for my family. Unfortunately, now I was a single parent. We, along with my sister, moved to our new house in July of 2009. My sister came to live with me to help me with the transition into my new home. I applied for adaptive modification grant for my home. The modifications took a few years to be approved, but eventually it helped to aid in my independence. At this time, I adopted Tomiko at the age of 7 through the agency. The agency also helped me through the entire process. My process was seamless, and all I had to do was go to the courthouse to see the judge who was knowledgeable about my ability to be the parent. In 2017, I gained guardianship of 2 of my great nieces, who was 5 and 9 at the time. I decided to get legal custody of them. They came to me alongside with CUA support provided by Turning Points, who stayed involved with the girls until this year. My nieces have flourished since living with me. They do well in school, and they are very loving and affectionate children. They always express that they never want to leave. Their story isn't an easy one, but we are so grateful for the happy ending. My nieces are now 9 and 12 and have been doing the best they can in school. My oldest niece has received first academic honors, a report card. My 2 18-year-old daughters are doing great as well. One has enlisted into the Navy, and she will be leaving for a boot camp after graduation. My other daughter made second honors this quarter with a GPA of 86.5, and she loves to do hair and is very talented. We are all home during the pandemic while I work. The girls go to school, and it has been a good thing for all of us. I was able to move through the adoption and foster process with the ease without having been questioned about my ability to parent. The advocate and court officials that I came across were competent and had support of the agency to guide me through all the paperwork. My core service provider was consistent in providing expertise to our family. But as we heard, my story is not true for many of my peers. I run a structured home that has been modified to my needs, which allows me to be independent as possible. And even today, I am blessed to be surrounded by family, friends, and church members who support and love us. We are living our best life, and I would love for those here today to work together to ensure that protections are in place so that my story can be true for all parents with disabilities. Thank you very much.
Thank you so much for your testimony, and it was a real testament to your work as a parent and providing such a welcoming space to not only your immediate family but extended family, and doing that is really inspiration for everyone in our city. So thank you so much for sharing your story. It demonstrates the real spirit of what I believe Councilmember Brooks is trying to achieve, to lift people up like yourself in your voice. So thank you for being here. Mr. Iannuzzi, can you call the next witness? I think we have two other witnesses for this panel.
I'm sorry, Mr. Chair. Are you talking about Clinton Crittenden and
Yes.
Jody Hoolan?
Yes, both of them did come on, so we can hear your testimony. Please state your name for the record and then proceed.
Hello, yes. Can you hear me?
Yes, we can. Thank you.
All right, hello, yes. My name is Clinton Crittenden. And I'm here to speak about the rights of parents with disabilities. Thank you for the committee and the Councilmember Brooks for her leadership on this effort. And I also work at Liberty Resources as an enrollment coordinator for our personal attendant care services. My and that of my wife's journey in hopes of fostering and adopting a child began when we were not able to have children on our own. My wife and I really wanted to start a family. We then discussed options that included fostering and adoption. In 2017, my wife and I contacted the CUA Turning Points to apply to adopt a child. A representative came out to our home to assist with completing the application. After completing the application, we were assigned to a social worker. We met with the social worker and informed her of our history with other agencies discriminating against my wife and I based on our disability. The social worker assured us that our disability would not be an issue. While meeting with her, we informed her that we were interested in fostering an infant child. She assured us that fostering an infant was very possible. We were then informed by the social worker about all that was needed to become a foster parent, like medical clearances, training classes, proofs of income, child proof in the home, things like that. So after our meeting with the social worker, we signed up for the classes at Turning Points on Frankfurt Avenue in Northeast Philadelphia. While completing the classes, the trainer asked if my wife and I could come early for the CPR class, so it would not slow down the normal. We would not slow down the class based on. He was thinking that we would take forever because of our disabilities with doing the CPR class. I've reported this to the social worker, but I felt that we were being discriminated against because of our disabilities yet again. However, the social worker did not do anything about it. After we completed all the training and necessary paperwork, we were informed by the social worker that she had a meeting with her manager and the trainer in which they concluded that it would be best for us to only foster teenagers. The reason why they gave us was because a teenager could basically take care of themselves, and we will only have to take them to doctor's appointments. Sorry about that. We reiterated to them that we were medically certified from our doctors that we were physically capable of taking care of a child. The social worker said that it was up to turning points and that they did not think that we could take care of a baby. Therefore, because of this continued discrimination against my wife and I, we have suffered mental anguish, emotional distress, and have given up on hopes that we will have a family that we have always dreamed of. It is our hopes that this hearing will bring forth change for parenting with disabilities and the end of discrimination against us. Our city's child welfare agencies and hospital systems must be required to educate themselves on their staff and their staff on disabilities, disability organizations, and the resources that are available for people with disabilities. The voices of parents and prospective parents like me must be heard. And in Pennsylvania, we need legislation that provides clear standards to prevent a situation like mine from happening again. I deserve to know that I will be treated fairly when trying to become a foster or adoptive parent. It is not right that my wife and I have to worry about whether or not the person I'm speaking with will be knowledgeable of the needs of my family and the needs of other parents with disabilities. Sorry about my thing keep flicking off. Okay, I'm sorry that is then. I'm sorry. That's all I have to say.
Okay, thank you, Mr. Crinden. I'm sorry to hear about the challenges that you and your wife have had in trying to become parents, but I do want you to know that as you are testifying, we have both the commissioners from the Department of Human Services, Department of Behavioral Health, Intellectual Disability Services, and Community Behavioral Health here on the line. So your voice is being heard, and thank you for adding your voice to this important conversation.
If I may, Council Member, during this hearing,
Dr. Brown, just state your name for the record for the stenographer.
Dr. Jill Bowen, Acting Commissioner for DBH-IDS. I just wanted to let you know that during this hearing, we have reached out to Connect Liberty Resources with our Director of Clinical Consultation for DHS and the QIS so that we can perhaps close some of these loops.
Okay, thank you. Okay. Mr. Iannuzzi, the next witness to testify.
Jody Hulan.
Good morning.
Good morning.
Thank you for having me. My name is Jody Hulan. I'm a licensed clinical social worker here in Philadelphia. I work for the Children's Hospital of Philadelphia Primary Care in Chestnut Hill. However, I do want to make it clear that I'm here today to express my personal and professional opinions, and my views are not those necessarily of my employer. I have worked in Philadelphia as a social worker since the 1990s, having spent 10 of those years at Philadelphia DHS as a frontline worker. I know the challenges that DHS faces on a daily basis. I have had to remove children from their parents' homes, and it was never something I looked forward to. During my tenure at DHS, I interacted with a few families with parents who had disabilities, but never had been so closely involved until about 3 years ago when I was called to advocate for Dominique Howell and her daughter. Ms. Howell has been bringing her daughter to our practice for her daughter's entire life, and I've gotten to know them through her daughter's wonderful, precocious personality. She's a lovely, bubbly child who loves the plastic shopping cart full of pretend food that I keep in my office and always runs in there to grab it and run around the office when she comes in. One day, Dominique called me and said that she was facing eviction from the property that she shared with her grandmother. And that began the saga of trying to help her and her daughter locate housing. I started to see how difficult it truly was to be a parent with a disability facing the potential of homelessness. I had never before understood the true challenges that parents with disabilities face until I went through it one-on-one with Dominique and her daughter. She had had a housing choice voucher, but she was unable to find even one accessible property for her in Philadelphia due to our aging housing stock, most row houses having stairs and have not been made accessible up until this point. So we contacted various agencies throughout the city, and one in particular was wonderful, and that was the Legal Clinic for the Disabled. So Dominique and her daughter were able to stay in a hotel for as long as possible. She paid out of pocket and then also received some help with funding through the Legal Clinic for the Disabled. When that funding ran out, her last resort was to turn to the shelter system. One day, I agreed to meet her at the Apple Tree Intake Center to help her through the intake process, only to find out that she was not even able to physically get into the building to complete the process because the building lacked a wheelchair ramp. On top of that, we found out that no shelters within the city system were handicapped accessible. At some point, some arrangements were made to help Dominique and her daughter get into one of the family shelters in the city. They were placed in a room that was closer to one of the facility's bathrooms in order for Miss Howell's convenience. However, the room that they were placed in had been formally closed off due to some sort of environmental issue, which she was never really told what that issue was. So essentially, they were housed away from the rest of the population in the shelter in a room closed off by themselves. The bathroom that they were able to use was not handicapped accessible. There were no grab bars for her. The toilet had no seat. Miss Howell was not able to take a shower in that bathroom. Luckily, with the help of the Legal Clinic for the Disabled, Miss Howell and her daughter were placed in a wheelchair accessible apartment after only a brief stay in the shelter. Miss Howell's story is unique because it is being heard. She is employed as an advocate for Liberty Resources. She was a Lend Fellow at CHOP. She was featured in an Inquirer story about her plight. She openly shares her story. But she is one person, and there are thousands in our city who do not have a voice. They fear their children being removed because they are a parent with a disability. The city needs more resources in form of accessible housing, mentorship, home health services, supports. Whenever I interact with a family who has become involved with DHS, I explain to the parents that DHS does not want to remove children from their parents. It is, in fact, the last thing that DHS wants to do. Unfortunately, because of a lack of resources within the family, and those families that have, lack of resources within the city, those families that have no support and nowhere to turn, sometimes DHS is the only option to ensure the safety of the children. Affordable, accessible housing is an important resource to allow parents with disabilities to raise their children independently. We must all work together to ensure that parents with disabilities have access to the same resources that all parents in Philadelphia have. Parents with disabilities are the experts. We must include them in the decision-making process and listen to their voices. Thank you.
Councilmember Green, you're muted.
Sorry. Thank you for your advocacy on behalf of the Howe family, and leading your voice to this issue. It's important that we have not only parents with children or people that would like or to have children who have a physical learning difference to speak up and lend their voice, but we also need others who are advocates to also demonstrate the challenges that they've seen with their own eyes to be a testament to these challenges as well. Are there any questions for this witness?
Councilmember, I just want to thank this panel, Ms. Thornton, for her leadership in parenting, Mr. Crittenden for sharing his story and him and his wife's story around this issue, and Ms. Holson for her support in that issue and kind of recapping that experience, because it was very hard for all of us during that time. So I thank you for sharing your stories and being a part of this conversation.
You're welcome.
Thank you. I echo the sentiments of Councilmember Brooks. Mr. Iannuzzi, can you read the names of the next panel? Each member of the panel, when you're about to testify, please state your name for the record.
The final scheduled panel consists of Bishop Gerald Scott, Cecilia Thompson, and Justin Salisbury.
Okay, Bishop Scott, if you can begin with your testimony. Okay, we'll try to come back to Bishop Scott. Cecilia Thompson, and it's always good to hear your voice. If you can begin with your testimony.
Absolutely. Can I be heard by everybody?
Yes, we can hear you and we can see you. Thank you. And if you can state your name and then begin with your testimony.
Awesome. My name is Cecilia Thompson, and I am the proud parent of a 22-year-old young man living with autism. While I do have a disability, I am not speaking today from my own challenges, but as an advocate for the past 16 years for families of children with disabilities. Before I share these examples, I want to be clear. What I'm sharing is not a reflection of the organizations to which these individuals work for. In fact, I see this as a great opportunity to provide maybe some professional development to individuals on how you work with somebody who has even intellectual disability, who's a parent who's living with autism, and not everybody living with autism needs assistance. And for those with physical or mental health challenges. That is my reason for sharing, so that changes can be made to help these families. That being said, whenever I provided support for individuals with IEP meetings with the School District of Philadelphia and the charter schools that are in Philadelphia, first, let me say an IEP meeting is very daunting and is very challenging for individuals without challenges. It's a very emotional process, and understanding your rights and what you can and can't do for your child is a massive undertaking. But when you're an individual, I'm gonna start with those with physical disabilities. While the School District of Philadelphia and some of the charters have made improvements, the reality is if you are living in a wheelchair, you cannot independently enter some of these schools without some type of assistance. And in my experience, the only option was a freight elevator, and there's no guarantee that the freight, for those schools who have freight elevators, there's not always a guarantee that the freight elevators are clean, because those elevators are not meant to transport individuals. In those instances where the family member, the parent who had a physical challenge could not enter the building, then we had to reschedule the meeting and find a location where that parent or caregiver or legal guardian could enter the building independently. The second challenge for families entering buildings are when they have either an intellectual disability, living with autism where they need that support, or a mental health challenge. One such example was there was a father who was coming from the service, and he had some challenges, mental health challenges related to being at war. Instead of being sympathetic to this person who voluntarily shared his challenges, the father unfortunately was seen as an angry parent. The person wasn't angry, and if anybody under the sound of my voice has been in war, maybe you can attest to this, to that father's challenge. But he wasn't an angry parent, and I would like to think, had I not been there to mitigate the situation, it could have turned left really fast. But we were able to get through it. I was able to keep the father calm and keep the situation so that we could talk about that father's child's IEP. Another instance, there was a mother living with Down syndrome, and I felt that for the first 5 minutes, the person was talking to me. And I'm like, no, don't talk to me. Talk to the parent. This is the one that's caring for this child. This is the one that's sacrificing for this child. This is the one that is making sure that is here and knew that she needed help and just reached out to an advocate, and I was available. So, and that was just not the first time, but I'm just using that example that oftentimes families living with Down syndrome or similar exceptionalities are overlooked or seen as, okay, my perspective is they're seen as, oh, they can't understand it anyway. They can't understand. Just break it down to where they are able to understand as you would any parent. And then a final example of this was a couple. They had some type of intellectual challenges, but they had a child. Okay. Once again, I happened to be there. They reached out, they needed help understanding the IEP process. And once again, the school team was looking at me. I'm like, no, I've talked to them. They understand. They just understand differently. So therefore, make this meeting so that they understand, not so that I understand. And then I will just share an example of when somebody's going for a hearing at CBH, you're allowed to have somebody with you, because I've had many grievances, and I brought somebody with me for moral support. Again, looking at me, no, don't look at me. This is the person that you need to speak to. I'm just here to help them through the process to be supportive. So, and again, I want to reiterate what I said earlier. This is not a dig at the organizations. This is just examples, and I have many, but this is just examples through my perspective in participating and supporting families where the parent had an intellectual disability. In the case of the father, some mental health challenges, and then the physical challenges, because every place in Philadelphia is not retrofitted for those living either in a wheelchair or needing to use crutches, as some families that I support with cerebral palsy that don't want to be in a wheelchair. They rather use their crutches. So, and I know through other things I do with CBH and DBH IDS, they do have peer specialists for different things. What I hope to come from this is that at least the school district and DBH IDS can work together. So when there is a family where it is known that that individual is living with some type of intellectual challenge or mental health challenge, that support is provided for those families the same way if English is not the first language of someone, that interpretation and translation services are provided. So should some support be provided for these families, whether they go to IEP meeting, whether they're at a grievance at CBH or any of the child serving systems. While we're trying to support, the children, let's also support these families living with these various challenges. Because again, whenever you're going through these child service systems, they're very complicated, they're very daunting, and everybody needs support. But for families who are living with disabilities, they need support also, just so they can understand their rights and be spoken to in a way where they understand what's going on, and where they're treated with dignity and not ignored with the perspective of disability does not mean stupidity. Disability just means just that. You just have a disability. If you're in a wheelchair, if you can't walk, you may need crutches or wheelchair. If you have an intellectual or mental health challenge, then you need that support to live a full, productive, and meaningful life in our society. Thank you, Councilman Green, Helen Gim, every legislative official under the sound of my voice, Councilmember Kendra Brooks, and I want a special shout out to your person, Kendra, Ms. Layla. She was very helpful in providing support as I prepared for this very important meeting this morning. Thank you so much for the opportunity.
Thank you, Ms. Thompson. It's always good to hear your voice. I hear your voice quite a bit when I get the calls from the school district regarding the work that you do on the committee and helping to educate parents that have children with disabilities. Also, as you were talking, it made me think of the fact that the University of Pennsylvania just made a significant gift to the school district to work on the physical plan of buildings in the school to address asbestos and other issues. And it made me think that with that $10 million per year over the next 10 years, those dollars could also be used to make accommodations to the various schools throughout the city of Philadelphia and the school district, so that parents that have a physical difference will not have to go through some of the things that you spoke about and that you address in the work that you do. I want to see if we have with us Bishop Scott. Okay. Justin Salisbury. Justin, are you here with us? Justin?
Can you hear me?
We can hear you. Good to hear your voice.
I Wonderful. Thank you so much for the opportunity to be here. Thank you, Chair Green, Councilmember Brooks, and members of the committee for taking the time to have this hearing. My name is Justin Salisbury, and I'm here representing the National Federation of the Blind of Pennsylvania. It's an honor to be here to not only talk about the issue, but also to talk about a solution. One of the benefits of national organizing, because we are a statewide affiliate with local citywide chapters, but we overall have a national movement where we have seen what's worked in other states. And so thankfully, Pennsylvania won't have to be the guinea pig to try to solve this problem. There are many other states that have moved forward with laws protecting the rights of parents with disabilities. And some people might think Pennsylvania is too conservative. Well, Alabama, Georgia, Tennessee, Missouri, Arizona, Utah can do it. So we're not too conservative. Some people will say Pennsylvania is too liberal. Well, Connecticut can do it. Hawaii can do it. I don't think we're too liberal. So I think we have the opportunity to make changes and to join the pack of states that have decided that parents with disabilities should be able to have children. So there's a law that we could basically create, and I'm going to talk about that a little bit. In the basic idea, we would be creating procedural safeguards to protect families and children whose parents have disabilities. Child welfare, family court, adoption, and foster care scenarios are the primary areas where these things come up. And so a lot of times there are different parts of the law that need to be adjusted in order to create a protection. Another piece that comes in with this that just sets the scene for why this is such a big issue that I haven't heard a lot about today is spousal abuse. A lot of times people with disabilities, if they're married to perhaps an able-bodied person, end up becoming the victims of spousal abuse, domestic violence, things like that. And when you have, for example, a disabled mother, an able-bodied father, and children in the home, and if he's abusing her, one thing that makes it a whole lot harder for her to leave from that situation is knowing that she cannot take her children with her because the state will not allow her to take her children with her because she has a disability. And there's definitely a disproportionate rate with which mothers with disabilities are abused. So that kind of thing needs to be addressed. Like this whole scenario needs to be fixed, partly so that then those mothers with disabilities and sometimes fathers with disabilities who are being abused can have that freedom to actually leave the abusive partner or spouse because they will be allowed to take their children with them, maybe. At least it'll be a fair shot at that argument. So we're not here to vilify or shame the agencies. A lot of times these hearings come together and certainly the government agencies and all the service providers want to come out, want to say we have policies, we're trying to follow the rules, we're doing our best, and it's possible that they are. We're not here to shame them. It's not about that. We just want to make sure that protections are in place so that parents with disabilities don't end up, because of the wrong ideas, the wrong misperceptions about disability and what we're capable of, don't end up losing our children or even being harassed in the process of trying to do something as simple as take our child to the doctor. So there's an equal protections clause that a lot of people will bring up and say we can't create a special protection for one minority where that minority has more protection than everybody else. We've seen that. We've seen how the Indian Child Welfare Act has been struck down because it gave a certain kind of protections. This isn't really that, though. What we're talking about is creating a set of procedural safeguards so that the disability status of nobody gets used as the reason to take their child away. So able-bodied people have a disability status too. That is the fact that they are able-bodied. In my case, I'm blind. That's my disability status. And so overall, nobody's disability status gets used, not just for the disabled parents, but for the able-bodied ones too. Part of the able-bodied privilege, of course, is that nobody in their right mind would ever come up with the idea, oh, because this person's able-bodied, we're going to take their child away. That never happens, and it's never going to. But that protection would still be in place. Public consciousness has been rising about keeping families together. We see this with the ICE detention facilities and separating families at the border because of what they look like or where they come from. We've seen Philadelphia in the national news for Catholic Social Services preventing LGBTQIA families from adopting children or fostering children. That is exactly the kind of public consciousness that can help us to make those changes in these other areas that matter too, but also in protecting the rights of parents and prospective parents with disabilities and the children that could be in their loving, caring homes with the right protections. There is a hesitation sometimes, as we've heard, for people with disabilities to contact service providers. And yes, that example with Walter Wallace Jr., I think, is a good one. I mean, a lot of times in communities of color, I may have said this in previous hearings, but I happen to be a mixed race person myself. I know I can pass for white, so I want to make sure that I don't appear tone deaf by saying this. But there are a lot of times in communities of color where the communities evolve, where the communities want to fix problems themselves and never call the police, where we develop these cultures sometimes in our communities where we just say, we don't call the police, we solve the problem internally. If we ever call 911, it's because we need an ambulance. And that kind of culture about calling social service providers and other entities that might report us to try to take our children away, that same culture exists within the disability community because it ends up causing so many problems so often. Now, some people think that this could be a function of social Darwinism, this idea that we're going to purify the gene pool and we're going to make it so that people with disabilities won't have kids because we make it so difficult. And then that will help make our society more homogeneous and uniform, and we won't have as many people with disabilities. There are a couple of problems with that. For one, logically, there are lots of people with genetic and other types of disabilities that we get congenitally that are born into families that never knew that that ran in their gene pool anyway. And maybe it's not genetic at all. Maybe it just happened as some kind of injury in the womb or something like that. And so if we were to try this Darwinistic approach, it would fail to actually address that for all of those other exceptional groups. But also it communicates to us as people with disabilities that our lives are not worth living. When people tell us that we shouldn't reproduce so that we don't spread our disability or pass our disability on to another generation, that communicates to us that people think our lives are not worth living. I think my life is absolutely worth living, and I think I have good things to contribute to the world. And if having children is a part of my life path, I'd like to be able to do it. Many people, though, just don't understand. It's not that they hate, it's not that they don't want us to have children, it's that they just don't understand how we could actually care for children. We've heard some testimony on that. And I agree with the testimony that I've heard earlier. When people simply don't understand, they think if I couldn't see, for example, if I couldn't see, I wouldn't be able to take care of children. I wouldn't know where the children are. Well, guess what? People who live as blind people, we know how we function. We do things like putting bells on the ankles or the shoes of our children so that we hear where they're going and we know where they are. And part of being parents, I mean, I've heard this since I was a little kid, fully sighted, where we never thought blindness would be a part of our family's discussions. And my parents would say, all dads have eyes in the back of their head. In other words, we learn who our children are, we learn how to anticipate their habits and their patterns, and we learn how to find ways to keep track of them and simply get things done to be able to raise kids. So parents with disabilities have those creative ways of being able to solve problems as well, and we can have all those kinds of good experiences with our children. So to make this very simple with the law, we're looking for a few things. And again, we've seen this in so many other states that we've seen what works, and we can put all the best pieces together in a nice Mr. Potato Head kind of fashion and put together the best law. What we're looking for is a law that would come in at the statewide level, and it would make it so that in child welfare, family court, adoption, and foster care proceedings, in none of those situations can the parent's disability be used as the sole factor to terminate parental rights or deem someone unfit to parent. If it is to be used as one of multiple factors, then they must be able to show a clear nexus between that parent's disability and the alleged parental deficiency. So what this will partly do is it will take the unconscious bias that a lot of people have, and it will force it to become conscious. And then people will be able to debate it. And a lot of times when that happens, quite frankly, it unravels, and we realize that that was all just prejudice, and it was us acting upon ableist ideas that have been fed to us by society by no fault of our own, but we as members of society have learned these ableist ideas, and we were acting upon them. Well, thankfully, because we made the unconscious bias conscious and we got to debate it, we found the truth. We realized that the disability wasn't the problem. And these protections will not prevent, for example, if a blind parent is abusing drugs and then you need to take their child away because they're abusing drugs, well, that's the issue. The drug use is the issue, not the blindness. And that is the core of this. We're just making it so that the disability isn't used as the reason. Also, supportive parenting services. When they are made available to people without disabilities, they need to be made available to people with disabilities as well. And we need to be able to, we should not bear the burden of proof. The people trying to take our children away should bear the burden of proof. They must prove by clear and convincing evidence that supportive parenting services are not appropriate for this situation and that they cannot make it possible for the child to stay in that home safely and that the taking of the child is absolutely necessary. Make them bear that burden of proof, because a lot of times when you're a minority, including when you're someone with a disability, you bear the burden of proof of proving that you're good enough or capable enough. In our case, we often end up getting treated as if we have the burden of proof to prove that we're competent, but we should be making it so that the entity trying to prove that we cannot raise a child, they bear the burden of proof and must prove that the supportive parenting services are not good enough. And those can be pretty elaborate. If you basically have a public health nurse living in your home with you, helping you raise the kid, not that I would want that, and most of us don't, but if you get to that threshold where you're having so much support, if even that makes it impossible for you to raise a child, I can't imagine what your scenario is. But this would give us the opportunity to prove that these services, which are already available to people without disabilities, can be available to us as well. Lastly, we would want to make sure that in this law, that we make a change or we make a special provision so that we can be sure that we expunge the records of parents with disabilities who are falsely accused or assumed incompetent. Because what we've also seen is that sometimes people keep calling child welfare services on a parent with a disability. And then when there actually might be some marginal, slight kind of issue where the person actually does need help, they go in and then they look like this repeat offender who's had tons and tons of issues. Then the bias is going to be against that parent because they have a long record of all these false accusations of incompetence. We don't want that to negatively affect parents with disabilities, so there needs to be a way to expunge those records so that all the times that we've been falsely accused don't come back to haunt us. So we do not want special training programs for people with disabilities, for parents with disabilities. A lot of times there's an idea that we need to come up with these special academies and programs that where we can train parents with disabilities on how to raise their children and take care of them. Well, the problem with that is that when something like that would come to exist, then there would be an assumption that parents with disabilities all require that. And we believe that we don't. It would be most helpful if we ensure that there's a level of competence in working with people with disabilities. and perhaps those systematic partnerships, so that if there is a parent with a disability that wants to access mainstream services, because we also don't want them to be provided in a segregated kind of way where then fewer resources get allocated to the minority group and everything else. We want to make sure that we can access the normal mainstream services and simply do so in a way where there's a level of competence for working with us in the fact that we have disabilities. A lot of times it's just parent-to-parent mentoring. You know, one blind parent finds another blind parent, says, hey, how do you do this? And we tell each other and we move about our lives. So we have been doing these kinds of things for a long time. And if we can just have these procedural safeguards, it's not about shaming or accusing or vilifying any particular agencies. We're not here to do that. And for anyone who might be concerned about having a new law that restricts what they can do, well, if you're not using someone's disability to take their kid away already, then you have nothing to worry about and nothing's going to change. But if someone is using a parent's disability to take their child away, then this will affect the way that you practice. And you might want to oppose some legislation like this, but we're ready for the fight. So we are really grateful for the representation that we've seen here, from the support from the City Council and from legislators who practice in Harrisburg. We are so excited to move forward and to work with any champions. And we thank you so much for the opportunity to talk about how we can protect the children and the families whose parents have disabilities.
Thank you, Justin, for your testimony. It's always good to hear your voice and see you and your participation. I think Bishop Scott is here, and I believe he is the last witness to testify.
Yes. Good afternoon. Well, to everyone, it's afternoon now. It's 12 o'clock. I'm looking at my clock. Thank you for the opportunity to present my case or my testimony. My name is Bishop Gerald W. Scott, and I have cerebral palsy. I was born with cerebral palsy many, many years ago. I'm 69 now, so I've been with it all my life. I raised my daughter as a single parent. I raised her she was born in 1984, and my wife and I separated and ultimately divorced. She agreed. She also was disabled. Let me say that. Hers was a condition that was different than mine. She had an automobile accident at 18 years old, and she became disabled because of it. She already had 2 children, and so she and I agreed that I would raise our daughter. And so I did that in 1985, and I raised her until she became a grown woman, actually a mother herself. I did not have many problems because of the fact that I had a lot of support. I had family support. I had my church. I was a pastor in the AME church for over 20 years. And so wherever I went, those churches were able to help me and assist me. And I believe that the community enabled me to do those things I could not do. For example, I could do everything. I was the one who trained her how to go to the bathroom. I had a girl child. I did everything, fed her, housed her, and all the rest. But the one thing that I could never do because of the dexterity of my one hand was I couldn't do her hair. I never could do that. I've tried, and it looked like a regular mess, to be honest with you. And so, being that she was a church daughter, we went to churches and functions that she needed to look properly attired and properly cared for in that respect. I gave her baths and stuff, but I couldn't do that. But I always had someone there, a friend, family member, church member, that would take that up for me. There were places that she wanted to go that I could not physically go with her and certainly not participate with her. She wanted to go to the park or to the, let's say, to the amusement park. I couldn't get on the rides, and so I had to have someone either take her or take her on the ride while I watched them enjoy themselves. But I always found a way to accommodate that, and so I never was in a position where anyone would come in and try to take over or deny me that right. And when I was the pastor in Delaware, I actually had a foster daughter. Not only my own daughter, but actually a foster daughter. She was 16 years old. And of course, her family were members of my church, and they could not take care of her any longer. And so they put her in a home. And I found out that she was put in a home, and I advocated for her, and I got to raise her as well. She was with me for over 2 years as our family member. So my position is that if you give us the accommodation, if you give us the support, if you give us the wherewithal by which we can do what we need to do, there's nothing that we cannot do. You know, I find offense somewhat in the word disability, because the word itself means one that's limited, disadvantaged, and disqualified from doing anything. And if there's any limitation, the limitations are far and few between, really. And the disadvantage is because I'm not assisted the way I need to be assisted. And I've never met one person, not many, I'll say like this, but I have as a pastor met people that were in the bed, they could not function. But of the 60 million Americans that have disabilities, and the many that I've met, there's not many that have been disqualified from doing anything. So just that concept itself is ableistic, in my humble opinion. And if we can get away from using verbiage that defines who we're not and discover for ourselves who we are, maybe people will look at us a little differently.
Thank you, Bishop Scott, for your testimony. I do appreciate hearing your voice and hearing your perspective. I thought you were going to take us to church. It's always a good thing to do that. It's a Friday morning, but some ways it feels like a Sunday morning. I agree with you in reference to that phrase. I have had a lot of conversations with both friends and advocates in the community regarding the whole word disability. I often use the language physical or learning difference, but I do support your sentiments in that regard. Are there any questions from members of council for this panel?
I just have a few comments, Councilmember Green. I want to once again thank the panelists for sharing their stories and offering more hope to the next generation of parents in general, on what it's like to be a parent and what it's like to be fighting and advocating for your needs and the needs of your children. And I look forward to continued conversations around the legislation that was brought up by Justin.
Councilmember Brooks, I think, is frozen. Okay, hopefully Councilmember Brooks will be able to come back. Are there any other questions from members of council for this committee? I'm sorry, for this panel, excuse me. Are there any people from the public that wish to testify that have not been given the opportunity to testify?
Hello.
Yes, thank you, Councilmember Brooks. Please proceed with your comments.
Okay, thank you. Once again, this virtual education and working at the same time from home is quite a struggle. But thank you guys so much. I just want to add, I want to send some special thank yous to Justin Salisbury for chasing me down as soon as I got elected to talk about this legislation. And I made a vow that as soon as I had an opportunity, we would bring it to the forefront. I want to also Cecilia Thompson, she called me Kendra because she was one of the very first parents that I worked with as a recreation therapist at Easter Seals. And Trevor and Cecilia both formed my thinking around what it's like to create possibilities, endless possibilities for folks that have differing abilities. And I also want to thank Mr. Scott for the testimony about being a father and a father of others and a leader in the church. And I appreciate that. I appreciate your testimony. And this committee will continue to work on making sure we're advocating and legislating around the rights for people with special needs and special abilities. Thank you.
Thank you. Seeing no additional questions or comments from members of council and also not seeing any other individuals from the public who are here and wish to testify. I just want to thank Councilmember Brooks for this resolution and having this conversation today. Definitely is very important, and it continues to advance the mission and work of this committee. And I want to thank you for your work and efforts in doing so this morning. I want to conclude today's public hearing of the committee. We will now recess this hearing until the call of the chair. I want to thank all of you for your participation, all the members of council, all the witnesses for being here. This was a great conversation. It gives us much more work to continue to focus on. I think it's in a great way to go into next week, which is our week of Thanksgiving. Thank all of you for your efforts and your advocacy for not only yourselves, but so many people here in the city of Philadelphia. Thank you and take care.
Thank you.